The leukocytes are also called as white blood corpuscles or simply the white blood cells of the blood. They are colorless and they defend the body against diseases by fighting against infections, malignance, etc. Leukocytes are classified mainly as a granulocytes and agranulocytes or non-granulocytes. Amongst granulocytes, neutrophil, eosinophil, basophil, the neutrophils makes the most of it, that is 60 to 70% of the total leukocytes. Eosinophil between 1 to 4% and basophil less than 1%. Among agranulocytes, lymphocytes forms 25 to 30% of all the total leukocytes and monocytes 2 to 8%. Lymphocytes, they can be classified as a large and small lymphocytes based on their size. These are the granulocytes and these are the agranulocytes. The granulocytes are the neutrophil, basophil, and eosinophils, whereas agranulocytes they are mainly the monocyte and mostly the lymphocytes. The neutrophil size is around 12 to 12 microns. They have a multilobular and they have both acidophilic and basophilic granules, whereas the basophil are bilobed structures. They have a coarse basophilic granules, whereas eosinophilic having a bilobed nucleus having coarse brick red granules in them, whereas monocytes and lymphocytes they are agranulocytes. Classification: neutrophil normal count is around 5400 cells per cubic millimeter of blood, can range between 3 to 6000. The size is around 10 to 14 microns. They're called as first line of defense mechanism. Nucleus in neutrophil is multilobed. Cytoplasm contains fine pink granules, both acidophilic as well as basophilic. The important function of the neutrophil are phagocytosis, and they contain a fuel producing substance, endogenous pyrogen. Neutrophilia is where there is increase in the neutrophil count. Some of the important causes are acute infections, particularly bacterial infection, following tissue destruction, pregnancy, menstruation, and lactation. Neutrophilia occurs. Neutrophilia is a decrease in the neutrophil count. Some of the causes are viral infection, typhoid fever, and bone marrow depression. Eosinophil normal count is around 275 cells per cubic millimeter of blood. It can range between 150 to 300. Size is around 10 to 14 micrometer in diameter. It is slightly larger than a neutrophil. Nucleus is bilobed. Cytoplasm contains coarse brick red granules. Some of the functions of eosinophil are: during allergic conditions, eosinophils are collected at the site and limits the intensity of inflammation by degrading the effects of inflammatory mediators. It leads also to mild phagocytosis. Eosinophilia is a condition where there is increase in the eosinophil count. It can occur in allergic conditions like bronchial asthma, parasitic infestation like hookworm. Eosinophilia is decrease in the eosinophil count. It can happen after the injection of corticosteroids and acute pyogenic infections. Basophil normal count is around 35 cells per cubic millimeter of blood, can range from 0 to 100. Size is 10 to 14 microns, slightly smaller than the neutrophil. There is a S-shaped nucleus. Cytoplasm contains coarse bluish black granules which may mask the nucleus sometime. Some of the important functions of basophil are: they are mildly phagocytic, they are responsible for inflammatory changes, and they liberate histamine and heparin. Basophilia is a condition where there is increase in the basophil count, can happen chickenpox, tuberculosis, and influenza. Basophilia is a condition where there can be decrease in the basophil count. It can happen after the administration of glucocorticoids, and it can happen during drug-induced reactions. Monocytes normal count is around 540 cells per cubic millimeter of blood, can range between 300 to 600. The size is larger, that is around 10 to 18 microns, and they're called as second line of defense mechanism. There will be a kidney-shaped nucleus and is placed eccentrically. Some of the important functions of monocytes, they are uh, active phagocytic cells, and all the tissue macrophages come from monocytes. They synthesize prostaglandin E and clot promoting factors. They kill tumor cells. Monocytosis is a condition where there is increase in the monocyte. It can occur in tuberculosis or syphilis. And monocytopenia is a condition where there is a decrease in the monocyte count. It can happen in hypoplastic bone marrow. Lymphocytes. Normal count is around 2750 cells per cubic millimeter of blood, can range between 1500 to 4000. And the large lymphocytes, the size is around 10 to 14 microns, and small lymphocytes 7 to 10 microns, the similar as that of RBC. Nucleus of lymphocyte is round, oval, and central in position. Some of the important functions of lymphocytes, that they produce antibodies. Lymphocytosis can occur, that is the condition where the lymphocyte count is increased. It can happen in lymphocytic leukemia, viral infection, and tuberculosis. Whereas lymphopenia, the reduced number of lymphocyte, can occur in hypoplastic bone marrow and